Adopting a vegetarian diet is often seen as a step toward better health, but when it comes to brain function, the reality is more complex. While plant-based diets can provide essential nutrients, they also pose significant risks if not carefully managed. The brain relies on a delicate balance of vitamins, minerals, and fatty acids to function optimally, and deficiencies in key nutrients found predominantly in animal products can lead to cognitive decline and neurological issues over time. One of the most critical concerns with a vegetarian diet is the risk of vitamin B12 deficiency. This vitamin, primarily found in animal products, is essential for maintaining nerve function and brain health. A lack of B12 can lead to increased homocysteine levels, a known risk factor for Alzheimer's disease and cognitive impairment. Symptoms of B12 deficiency often develop gradually but can become severe, resulting in memory loss, confusion, and even irreversible nerve damage. Since plant-based sources do not naturally contain adequate B12, vegetarians must rely on fortified foods or supplements, yet many fail to meet the necessary intake. Another major issue is the deficiency of long-chain omega-3 fatty acids, particularly DHA and EPA, which are crucial for brain health. These fatty acids play a significant role in maintaining brain cell membranes, reducing inflammation, and supporting cognitive function. While some plant-based sources, such as flax seeds and walnuts, contain ALA, a precursor to DHA and EPA, the human body converts ALA to these essential forms at an extremely low efficiency, often less than 5%. This puts vegetarians at a disadvantage, as studies show that lower DHA levels are linked to increased risk of cognitive decline, depression, and even psychiatric disorders. Without proper supplementation, the brain may struggle to maintain optimal performance. Iron and zinc deficiencies are additional concerns. While plant-based diets provide non-heme iron, it is less absorbable than the heme iron found in meat. Low iron levels can result in decreased oxygen transport to the brain, leading to brain fog, fatigue, and impaired cognitive function. Zinc, another essential mineral for brain signaling and neuroplasticity, is also less bioavailable in plant foods. Insufficient zinc intake can weaken immune function, slow neural processing, and contribute to mood disorders. Although some plant-based sources contain iron and zinc, their absorption is often inhibited by compounds like phytates found in legumes and grains, making it difficult for vegetarians to obtain sufficient amounts through diet alone. Beyond nutrient deficiencies, there is also concern over the long-term effects of a vegetarian diet on brain aging. Research indicates that an inadequate intake of key nutrients over time can accelerate brain atrophy and increase the risk of neurodegenerative diseases. A poorly planned vegetarian diet may also contribute to imbalances in neurotransmitters, leading to symptoms such as anxiety, depression, and poor concentration. While proponents argue that vegetarian diets can be beneficial for overall health, they require careful monitoring and supplementation to ensure brain health is not compromised. Despite these risks, some vegetarians attempt to optimize their diets by taking supplements or consuming fortified foods. However, relying on artificial supplementation rather than natural dietary sources is not always foolproof. Nutrient absorption varies among individuals, and supplements do not always provide the same bioavailability as whole foods. Furthermore, the long-term effects of relying on synthetic nutrients are still being studied, leaving uncertainty about whether supplementation alone is enough to fully support brain health. For those considering a vegetarian lifestyle, it is essential to approach it with caution. Without strategic planning, eliminating animal products can lead to severe nutrient deficiencies that negatively impact brain function and overall cognitive well-being. Regular health checkups, blood tests, and personalized supplementation are necessary to mitigate the risks associated with this diet. While plant-based eating may offer benefits in other areas of health, it is crucial to recognize the potential dangers it poses to the brain and take appropriate measures to prevent long-term harm.